Firstly, welcome everyone this evening to our webinar on our draft standards for the initial education and training of pharmacy technicians. We really appreciate you taking the time to join us this evening. My name is Lindsay Cleland and I'm the Chief Standards Officer at the General Pharmaceutical Council, and I'm joined this evening by a number of colleagues who have been involved in the work around developing these draft standards, and they'll introduce themselves as we go through the evening. I'm now going to hand straight over to my colleague Siobhan McGuinness, who is our Director of Scotland, who along with Parima Shah are going to take you through some of the key details and some of the proposals. So over to you, Siobhan. Thank you.
Thank you very much. I'm going to share my screen now, so thank you. Bear with me while I get it up and running. Hopefully we can see the slides that I am presenting today, along with Parima Shah, who is our Senior Policy Officer with a specialist education background. You'll see that there are 3 names on this slide. We do also have Olivia Musson, who is our Pharmacy Technician Clinical Fellow. However, she's unable to attend tonight, so it's myself and Parima that will be presenting this this evening and answering the questions that you may have. So thank you very much again for taking the time out this evening on a Thursday night to hear about the future standards for initial education and training for pharmacy technicians. Throughout this presentation, the aim is to give you a bit of background about what we're aiming to do, where we are just now, what the proposals are, the main changes within that have been that are at consultation at the moment, what we believe the main impacts are through the proposals that we have, what the wider considerations are for both the pharmacy technician profession but also wider healthcare in general, and we'll also give you an update on what the next steps are as well in terms of from the consultation, then the publication of the standards and how that will be implemented. So that's just to give a very brief introduction as well, so that we've got the purpose of this evening. So I suppose first off, what I wanted to do was just give a little bit of background into why we're here. So for those of you that are maybe not quite as familiar with our strategy and our vision as well, I'm conscious I live and breathe it. So our vision for 2030 is safe, effective care at the heart of healthier communities. And within that, we have recently published our new strategy just earlier this year. And the very first aim of that strategy is actually about empowering our pharmacy professionals, so pharmacists and pharmacy technicians, to provide trusted, safe and effective pharmacy care. So right within that aim, one of our strategy is making sure that our pharmacy technicians have the right underpinning knowledge to be able to provide that safe and effective care. Our last standards update was a wee back in 2017. There's a lot happened in the 8 years between then and now, as I'm sure we can appreciate, right across healthcare, across the wider world in general as well. So, you know, part of the reason for the update is that it's time for them, but also there have been major reforms of which, you know, I don't need to tell you all about them as well. Lots of developments across delivery of healthcare as well, you know, and loads of changes, most of which have been positive. At this point, I would just like to highlight, because I know it's a question that is likely on the minds of many, is that any pharmacy technicians that are already registered, there's no change in requirements for registration. So it's just to put your minds at ease. There's not going to be any change. We're not introducing new courses or anything like that to stay registered. This is just about the initial education and training standards being slightly, our proposals are to change them to keep in line with current practice, current thinking and current delivery. So hopefully that puts your mind at ease. We are conscious there are lots of questions around post-registration and what that means in terms of our very experienced workforce as well. I believe we're up at nearly 28,000 pharmacy technicians now, so not a small number, and something that's really, really, really promising and really good. So in terms of that, you know, it would not be in anybody's interest to change those registration requirements for currently registered pharmacy technicians, and this is about that evolution of healthcare. Without further ado, what I'm going to do is I'm going to hand over to my colleague Parima, who's going to talk you through the role of pharmacy technicians as well. So I will hand over to Farima just now.
Thank you, Siobhan. So I'll talk a bit about the role of pharmacy technicians. So as most of you will know, pharmacy technicians are a registered profession and a protected title. They work within the multidisciplinary teams, delivering care and work within a wide range of sectors and roles, which I'll go into in the next couple of slides. So as of September, there are 27,484 pharmacy technicians on the GPHC register. And at the moment, to be able to register, you have to be on a GPHC approved course and complete it with a minimum of 2 years work experience in the UK as well. The equivalent of the sort of RPS for pharmacists would be the APT UK, which stands for the Association of Pharmacy Technicians UK, who are their professional leadership body. Some of the settings that pharmacy technicians work at, as I mentioned earlier, is a wide variety of different settings, would be in the community sector, the hospital sector, primary care, amongst others. And there are some niche sectors as well, such as the justice sector as well. And some of the areas of practice are dispensaries, wards, clinics, and increasingly also home care, online pharmacies, that sort of thing. And there are also various specialist roles now. So, for instance, in cardiovascular or mental health. And some of the other advancing areas are in oncology and home care. And at the GPHC itself, we have pharmacy technicians working in our inspectorate team and fitness to practice team as well. Some of the changes to the national picture for pharmacy technicians, which have been quite a few since the last set of standards in 2017. So we've had the introduction of the patient group directions in June 2024. And we've had changes to supervision legislation, which will enable pharmacists to authorise pharmacy technicians to supervise the supply of medicines and to take primary responsibility of unlicensed manufacturing units, and also hand out checked bagged prescriptions in the absence of a pharmacist as well. We've been reviewing the initial education training standards for pharmacy technicians for the past couple of years now. And the consultation on that is now live, where we've proposed new standards and learning outcomes. There's also a couple more links on the screen, as you can see, to some useful resources on the APT UK website. Next slide, please. So there are various training opportunities for pharmacy technicians. So there's a list of clinical courses on the screen there. That includes some higher level sort of enhanced practice program. So level 4 enhanced practice program for pharmacy technicians, and then there's a diploma at level 5, and then again an apprenticeship at level 6. So beyond the sort of initial education and training, there's various opportunities for pharmacy technicians, and then there are community pharmacy technician funded apprenticeship places as well, and accuracy checking technician courses. And at the moment, the CPPE leaders program is now open to pharmacy technicians as well, the chief pharmaceutical officers one. Next slide, please. So as you can see on the screen, there's been various changes to the role, as I mentioned earlier, around legislation and practice, and there's increasing specialist clinical roles as well, and the scope of practice has increased as well in terms of the PGDs and public health, and as well as the changes to supervision legislation. And for that reason, now we felt like now's the right time. And next slide, please, Siobhan. So at the moment, a few years ago, we felt that that's the time to sort of start the lead into the review. We done 3 waves of pre-engagement work since 2023. The first wave was sort of engagement with the initial education and training providers for pharmacy technicians. And from that, we felt that we needed to do some research, where we commissioned some research to look at the standards. And whilst the initial sort of engagement and research showed us that the 2017 standards are adequately preparing pharmacy technicians for practice and are an improvement on the 2010 standards, we still felt that there's quite a shift in the healthcare sector towards multi-sector and multidisciplinary working, as well as a few other emerging themes such as environmental sustainability, technology, and equality, diversity, and inclusion. And in order to take an anticipatory approach to regulation, we had to take into account these changes to healthcare delivery, as well as the professional and national priorities as well. We are committed to working with other organisations and individuals to achieve our vision of safe and effective care for patients and the public. So we've done further waves of engagement work. Next slide, please. So in the second wave, we engaged with a wide variety of stakeholders, including patients, the public, registrants, and we also held workshops where people had the chance to input on the actual standards and learning outcomes. So we looked to get input from all angles, including trainees and registrants, as well as educators of the initial education and training for pharmacy technicians, and also accreditors who approved the training providers, and also employers of pharmacy technicians. And then even within these groups, we've tried to be as representative as possible of the different sectors, such as hospital, community, as well as representation of all across all GB nations. From this, we then moved on to the third wave of engagement. Next slide, please. So in this third wave of engagement, we liaised with the chief pharmaceutical officers and statutory education bodies to understand sort of at a strategic level the direction of each country and that they're working towards. This included sort of engagement and considerations on multi-sector training and whether or not the RQF levelling is at the right level as well. So what we learned from these key stakeholder meetings is that they are keen on the direction of travel for the RQF level to change to RQF level 4 and to do so at a national level. And we gained expert input from these from the industry and from our expert learning outcome drafting groups on what the learning outcomes need through the lens of RQF level 4. And now I'll hand over, I believe, back to Siobhan.
Right, thank you, Farima. So hopefully you can see that, we know that pharmacy technicians are in every sector of healthcare. So with that, as the regulator, we need to make sure that practice remains safe and effective for all patients as well, which has led to this review. The other thing I would highlight is clearly from all the pre-engagement work as well. We are not working in silo. We have worked with multiple people across a range of sectors as well. And importantly, we have taken into consideration views from the public as well. So just to kind of move on around more specifics within the consultation that we have that's live just now, we talk quite openly about standards, we talk about learning outcomes, and I suppose there's something about, well, what does that mean as well? So within the General Pharmaceutical Council, what we do have is a sort of standard structure, or a structure that remains the same across all of our education standards. They come in two parts. So the first part is the learning outcomes. So that's for the individuals, and that's based on knowledge, skills and behaviours, and that's what the individual needs to meet to be able to then progress to registering with us. We also then have the provider standards. Now, the provider could be a higher education body, it could be the training organisation as well. So they have to meet standards that then allow them to deliver the course for study. From that, it makes sense that absolutely collaboration is essential, particularly, to make sure that those that are successful in the courses do come onto the register as well. We know that we've got lots of placement activities, we know that we need supervisors, and we know that we need the education providers as well to all be on board with that, so that we've got so that we're moving in the same direction as well. So collaboration is absolutely key, and we're just one small part of that. So I suppose that leads on to what are our main key proposed changes, because with any consultation document it can be a bit of a read. So the aim of getting this presentation this evening is so that we can discuss what the higher, at a sort of level, what are the changes that we're proposing. Now, we talk about RQF levels as well. Now, RQF is Regulated Qualifications Framework, which is what's used within education across England and Wales. And in Scotland, we talk about SCQF, or Scottish Credit and Qualifications Framework. The numbers are a little different, and I will put up a table in a second with the equivalences, or the approximate equivalences, so that it's a little bit easier with an example qualification on it as well. That's partly for me to make sure I don't get it wrong, but also I think it is quite helpful, particularly if we will have representation across the three nations on this call tonight. So I suppose what we're looking for is, based on all of the changes that Farima has went through in terms of, the workforce, it's felt that perhaps the RQF level 3 could move to RQF level 4, which gives that initial education. Now, to be clear, that would be on completion of the training, so it's not at the start, but that would be the level that would be achieved by the end of training. With that, we then had to review the entry requirements. So right now we have maths and English as a requirement, RQF level 2. To put that into perspective, that's a sort of a GCSE or a Scottish National 5. So that's in place at the moment. A lot of course providers already ask for science as well. And the change that we're seeing is that we're now mandating that. Now, when I say we're mandating science at a level 2 or equivalent, that can be using practice as an example. So one example that we have seen quite a lot as well currently is a pharmacy support worker as well, to allow them to progress on to pharmacy technician training if they so wish. So we are very cognizant of that, and we do not want to be creating barriers, but we also need to balance the academic output as well, and make sure that we're giving everybody the best chance we can. So that is one of our proposed changes as well. And another thing that I just wanted to highlight as well is around that educational supervision. We're introducing a designated educational supervisor role as well, to help strengthen that with the education and recognising that increase in level as well. So as promised, I do have a table of the comparison of the levels. Now, it's fairly crude in terms of, that it's an approximate equivalent, but it's just to give that idea of what levels we're working at. So we are currently on qualification at level 3 or 6 in Scotland, which is equivalent to A level or higher. And then we're proposing to move that to a level 4 or an SCQF 7, which is equivalent to that first year university or an HNC. So that's what we're looking at. Other things that are within the consultation and that we're looking to do. So we're looking to expand that scope as well on initial education and training. We recognise that a lot of the pharmacy technicians that are already practising have already got a lot of this as well. So it's about just bringing that into the initial education. One of our proposals is mandating final accuracy checking. Again, we know that a lot of providers already have this embedded as well, and a lot of a significant amount of pharmacy technicians are already doing this. So this felt like a reasonable and natural step to take. We talk about embedding digital skills for safe practice as well. Now, we know anybody that's in practice will have digital skills as well, so it's just bringing that in at the initial education level. The GPHC do not dictate what systems are being used across healthcare, but it's just making sure that there's skills, knowledge and awareness of digital programs that are in use. The other thing that we are discussing as well is about having a raised awareness of genomics in patient care as well. So those that are much cleverer than me will know that this is already, you know, a study of genes, particularly with DNA functions and influence. How does that affect medicines? How does that affect individuals as well? And that's just something that we wanted to introduce as part of our standards to make sure that that is being considered as that. I suppose as that's an emerging area of healthcare as well. Farima's already touched on this around environmental sustainability within pharmacy practice. We all know that we should be considering the environment and the climate and everything that we do as well. So this is just adding that in as a learning outcome as well, just to have that awareness and promote sustainability across pharmacy and wider healthcare as well. The other thing that we are proposing as well is that we would very much be encouraging multi-sector training. I'll highlight the word encourage. We are not mandating it, but we would strongly encourage it as part of the proposals that we have. That may lead to some questions, it may not, but that's just something to kind of have there as well as a progression as well. As we know, and as was outlined earlier in the discussion, is that, you know, pharmacy technicians are working across a wide range of roles and specialties, so multi-sector training can help with that as well, just to give that awareness and experience as well as far as possible. So I suppose that kind of brings me on to what are the benefits of the proposals. Now, this is what the GPHC believe are the benefits of the proposals that we are making. We recognise that there may be other benefits, so it's not an exclusive list. I promise there's more than 4 benefits, but these are the strongest ones that we feel come across. So by doing this, it does allow for a stronger professional identity for pharmacy technicians, which I think is something that, you know, we would all be quite keen to do as well. Enhanced patient safety, that is what we are in the business of doing as a regulator, is making sure that patient safety remains at the heart of everything we do. And some examples of that, you know, are around that final accuracy check in the genomics informed practice as well, and some of the other learning outcomes that will be coming with that. We believe that the better preparation for digital healthcare by having those skills as well mean that anybody that is studying to become a pharmacy technician just has that, it feels more able to kind of hit the ground running with that as well. And integrated care systems, as we know, these things are always interesting as well when we're in practice. So there's something about just having that preparedness as well, to understand that there are lots of lots of systems in place as well, and having that good understanding of them. And like I've already highlighted as well, it's just that contribution to climate and sustainability goals, both within healthcare but also wider as well. It wouldn't be right if I just talked about the benefits. I also need to talk about some of the challenges and risks that we've identified, and I'm sure that there will be some discussion and perhaps questions on that as well coming later. We recognise that there will be a transition for this, a transition period for both, well, I'm saying for providers and trainees, but actually for the whole of healthcare as well. So we recognise that the period of transition from moving the course from where it is, well, from moving the level of qualification from where it is currently to the proposed level, it will take a bit of time to embed. Any change does, and we also need to be cognizant of that. We propose that with this, and depending on the results of the consultation as well, there will be an implementation advisory group set up as well. It will be overseen by the GPHC, and that will pull together representatives right across the profession, wider healthcare, and across the nations as well, to make sure that we do get this right. So from right at the start, that is what we're looking to do. Other challenges and risks that we have to consider is accessibility. So we've already talked about the entry requirements and that introduction of science as a mandated requirement or equivalent to science. Then that is something that we will need to be monitoring, and we recognise that that is a risk. We also recognise that with any change to education, and also when we're introducing the encouragement of multi-sector training, this does instantly give a bit of a logistical issue as well for the employers and indeed training providers and the individuals that are undertaking the course as well, about how do they perhaps work that in. And we recognise there are funding issues as well, and we are in discussions with our stakeholders around that as well. All of this, I suppose, comes to, to sort of summarise that, is about how do we balance inclusivity with the raised academic standards that we are proposing. So we are hopeful that we're cognisant of all of that, and that through our consultation as well, that we will get that feedback as well about are we going in the right direction as well. So that's just to kind of put that out there. I am going to hand back to Farima, who's going to discuss our equality impact assessment and some of the wider considerations that we've made as well. So I'll hand back to Farima now.
Thank you, Siobhan. So we do have a legal duty to equality when we develop or review our policies. And this comes from the fact that any changes to education standards can have unintended consequences, which can include barriers or disadvantages for certain groups, as well as sort of possible positive impacts as well. So to identify what these impacts are on different sets of people, we conduct an equality screening impact assessment, which is an evidence-based check to see if any of our proposals are likely to have a differential impact. Next slide, please. So the protected equality groups are usually identified by the 9 protected characteristics, as you can see on the screen there. They include age, disability, sex, race, religion, etc. But we recognise that equality screening isn't necessarily a tick box exercise. So we've also looked into non-protected characteristics. These can include things like socioeconomic background and caring responsibilities, or geography, for instance, or where someone is based in the country, and that sort of thing. Some proposals might affect multiple characteristics. So we do know that, for instance, socioeconomic status is one of the things that does tend to interact with most of the protected characteristics. And we do sort of do our best to make sure that the proposals that we propose are fair and evidence-based, but and whilst this may be the case on the surface level, there can always be unintentional barriers for certain groups. So in the next slide, I'll discuss some of the things that we have identified. So for instance, some of the key risks we've identified is with age, as we've introduced sort of the digital literacy requirement as part of the learning outcomes, and also the re-entry challenges, having that science qualification. If you're not coming straight out of school, that might be one of the risks. Another example is, for instance, rural learners may have sort of fewer placements available to them, which does mean that the multi-sector training would become a little bit more difficult. So these are just some examples. And on the next slide, I'll discuss the mitigations for them. So some of the ways we can mitigate the risks discussed previously is to encourage providers to deliver flexibly. So that's remote, blended, and face-to-face. And then putting reasonable adjustments in place for assessments and learning, as well as encouraging that those sort of peer networks and mentorship relations, and also annual monitoring to look at protected characteristics and review them on an annual basis.
Thank you, Farima. So hopefully this gives a bit of an indication of the work that we have been doing to try and consider all of the different risks that we potentially are looking at when we are looking at the standards. Now, that's not to say we do look at this with the current standards that are in place as well, but we recognise that any kind of change, we need to then focus onto that. So that's why we have been looking at this quite closely and looking at the data that we have available. And I suppose at this point, what I would like to sort of discuss is some of the wider considerations that we have as well, and then the next steps before we kind of move to that question and answer session. So I did say at the start that there are no changes to the requirements for registration of already registered pharmacy technicians, but I just want to highlight that again because I know that it has caused considerable anxiety as well. So it's just to put that one to rest, hopefully. But I do recognise that that might still be playing on the mind. We recognise and we have heard that there's a lot of feedback around, how does the supervision part work, and what about the confidence in pharmacy technicians who are already practicing and being able to have students that are perhaps studying at a slightly different level as well. And this is something that we are considering very carefully as well, but we are confident that the experience that the pharmacy technicians that we already have is absolutely that's best practice, that we've got that experience. So hopefully the confidence will come with that, but we are working closely with our education providers and the professional body around how that will look in practice as well, because we wouldn't want people to not feel confident as well when we've got new students coming through, if the proposed new standards are accepted through the consultation as well. So hopefully that's something that gives a bit of reassurance that we are considering that. As a regulator, revalidation is one of those words that comes up every year as well. We know that we have our revalidation requirements as well. At this point in time, there's no change to the revalidation requirements that would affect the initial education and training of pharmacy technicians, and nor would it affect the current pharmacy technicians already on our registers as well. But clearly revalidation is always a consideration about how do we make sure as a regulator that we can assure that practice as well. So it's just to kind of highlight that, but like I say, there's no planned changes to that. And I suppose that kind of just brings me on to the next steps that to give you a bit of awareness of that. So currently our consultation is live. It is closing on the 24th of December or Christmas Eve as well, and it's been open for 12 weeks, as is our standard requirement for any consultation like this. The more responses we get, the better informed that we are. So I would encourage everybody on this call to please do submit an individual response, and please do encourage your organisations, whoever they may be, as well, to also submit responses so that we can take all of that and do a full analysis. I did mention earlier in the presentation about that we will have an advisory group to set up that will consider the implementation of any changes as well, and how we best do that. So that group is currently being set up and should hopefully meet early in the new year to start discussing what's coming through in that consultation as well, and what the next steps are. I did mention earlier that whilst this is the initial education and training, it clearly goes hand in hand with post-registration assurance as well. We do have a post-registration group that's already in place as well, and we're working closely with them to make sure that the impact and next steps are considered on a more wide basis, and we are in conversations with, again, the professional bodies and other stakeholders to make sure that we're not missing anything, and we're making sure that that post-registration experience is considered as well. So whilst it's not part of this consultation, it's not something that we would be ignoring. We can't take anything in isolation is essentially the message there. So the consultation will close on Christmas Eve. The analysis will be then undertaken in the first few months of 2026, and the final standards will be published post analysis and post review as well. So we're aiming, and it's possibly ambitious, but we are aiming for spring or summer next year to have them to have those published, and then the implementation phase would be starting thereafter as well. I can't quite put the timing on that because that will very much depend on the results of the consultation about what that might look like as well. And just to hopefully provide that reassurance as well, is that we will continue to have ongoing monitoring, not just of equality impacts, but also the wider impact as well. And we do hear regularly and routinely from stakeholders, individuals, and the wider public around what's working well and maybe what's needing improved as well. So we will continue with that, as is our duty as a regulator, as well. And just finally, we do have the link on the slide here, or indeed it's widely available through Google and any of our social channels as well. Will take you directly into that.